Hello and welcome to the SOFEA Sessions podcast. Today's shorthand episode is with our social prescriber link worker, Selina, who has come on today to talk about what social prescribing is, why it's needed in the community, and how you can refer for support. Hello, Selina.
Hello.
Welcome to the SOFEA Sessions shorthand episodes.
Thank you.
How are you doing?
Yes, not too bad, thanks.
Good, I'm glad to hear it. So my first question for you is, who are you and what is your role at SOFEA?
So my name's Selina and I'm a social prescriber link worker and I'm employed by SOFEA, but we work with the Didcot Primary Care Network, which is the 3 Didcot surgeries in the local area.
What is social prescribing?
I'll give it a go. It's quite difficult in a nutshell, but social prescribing, so it's a term that we use when we look at taking a non-clinical approach to challenges and barriers that people might be facing. And when we say non-clinical, so we're not doctors or nurses or anything like that, and we work alongside people to give them a confidential space, time to discuss the challenges or barriers that they might be facing and work together really, all focused around them, what they want to achieve and where they want to go, or non-judgmental, and it's just offering them support at times of need.
Okay, fantastic. So how did social prescribing begin and how is it linked to SOFEA?
So as SOFEA, we run a community larder, which is where people can access food at a discounted price. I myself was a volunteer, and what we were finding is that people would present at the larder to access food, but also really struggling in life. And I was the kind of person that's quite well linked in the community, do a lot of volunteer work. And I was the person that they would kind of confide in. We'd have a constructive conversation on, have you been to this organisation or maybe think about this option? And that was kind of where it was recognised. And the local surgery sort of looked at it and thought there's a different approach here to helping people. And quite commonly they were having people turn up at surgeries with social issues that they were facing and not really knowing how to support that person or what to advise.
Amazing. So actually before social prescribing was a contract with the PCN, in some ways you were already doing it. So you were listening to the larder members as they came in, signposting services that might be able to help them with their social or emotional needs. And like you say, rather than, clinical medical support, because my understanding of social prescribing and kind of where it came from, just to touch upon that, was that there was lots of people really struggling in their lives with non-medical related issues, but were going to their GP because that was someone that they trusted and thought would be able to support them. But obviously that puts a lot of stress on GP surgeries and the wider NHS in terms of cost, doesn't it?
Yeah, so
It
absolutely.
sounds like social prescribing is really needed.
Yeah, we've actually sort of done a bit of a project on that with people that have, they sort of analyse it, certain amount of appointments in a certain amount of time, and then to pick away and have a look to see what the social challenges may be that are bringing them to the GP, because they had no sort of specific medical need. So that is something that we have kind of looked at with the PCM.
That's amazing. And I think as well, just kind of a side note on that is being able to have that massive data and people, feeding into that and being able to look at within our community, as in Didcot, what are the key areas that people keep going to their doctors around? What are the, the pain points that people are really struggling with, and how we as a community can we support people and maybe even fill some of those gaps?
Yeah, absolutely. That is something very much forecast in the future, is that we do identify gaps all of the time, and we're trying to constructively feed that back to relevant organisations, and then also try to look to the future to how we can change that within our community. And it's really about empowering people to actually take some control and, help each other and get through those difficult times.
So in terms of, obviously, social prescribing is a massive project now, and obviously it's got lots of impact, but what do you think the need is? Why is social prescribing needed in our current kind of community?
So I think, we can all see that our communities are growing all the time, no matter what area we live in, and services are stretched, and we are struggling to fill GP vacancies, and it's maybe about looking at a different approach and some preventative work, so people aren't getting to the point that they're in crisis, that actually they've got sort of low level mental health, that we can actually empower them to help them to feel better within themselves before they get to that pinch point where it's then crisis and the services are overrun and waiting lists are extensive.
So how do you think social prescribing is different in terms of the approaches used that maybe you'd see differently if you were to go see a doctor or a nurse in a GP surgery, aside from the fact that it's non-clinical and non-medical?
Yeah, I think being non-clinical and non-medical does put people at ease, and they're more likely to open up and actually tell you exactly what's going on. Now, it's very difficult for a GP with a 10-minute appointment to assess somebody's need if it's historical or it's something that's been going on for a long time. And we just have that relaxed environment that people can actually take their time, discuss multiple issues. And we also do look at sort of full family approach. So what I mean by that is, a mum might present at the doctor's with, headaches reoccurring and low level sort of mental health condition. But actually the root cause, maybe one of her children is going through a difficult time at school. So again, that's somewhere we can kind of help and bridge the gap and open those lines of communication.
What do you think the impact of social prescribing has been so far, and how are you evidencing that?
So I think the impact, we've been doing it for the last sort of 4 years. Patients continually feedback that it really does help them. And the fact that we see people, they return, not on a regular basis, as in like every week, but we may see somebody 6 months ago and then they reappear in 6 months' time because, again, they just need that bit of light touch support and guidance, really. And again, if we're looking at people that have large amounts of sort of doctor's appointments or medical interventions, obviously that's something we can monitor. And if we can see that those appointments are going down, and that they're appointments that are maybe around the social issues, so making that really clear, it's not if you've got diabetes, you shouldn't go to your doctor for your health checks. This is around other issues that may impact you, which then leads on to impacting your medical condition.
Yeah, that makes sense, because there is so much like co-occurrence with medical, and we always talk at SOFEA about the connection between our mind and body when we're doing psychoeducation stuff with the young people. And absolutely, yes, there might be a medical need there, for example, diabetes, or if we're talking mental health, it might be depression or anxiety. But actually, it sounds like social prescribing allows that kind of approach to look at the whole person and go, what's going on in your employment situation? What's going on at home? Have you got enough food? Are you under a lot of stress? Are you having financial troubles? Because all of that is going to impact not only your physical body, but your mental well-being, right?
Absolutely, yeah. So time again, we see that there are always sort of multiple issues going on there. And you're right, one does affect the other. If we're under increasing pressure because we've lost our job and finances aren't great, and then we're struggling to do our food shopping, and if we've got a long-term health condition, that is going to have some, it's going to be there and present. And it's going to knock on to that medical condition.
Yeah, absolutely. So who does social prescribing benefit, do you think?
So I think it benefits not only the individuals that obviously we help to support, but also services like the GP surgeries and beyond, because we do very much work and take a whole team approach. So we'll be in regular contact with adult mental health or health visiting teams. And I think having that picture filled in when, clinicians don't have a lot of time to fill in that whole picture of what may be going on with an individual or a family, it's invaluable because then they've got the picture. They're able to be quite precise with the interventions or support that they're offering. And it just makes everything a little bit more streamlined and best outcome for the patient, which is the most important thing.
Yeah, I mean, it really does sound like a way of working smart in terms of that, people stretch capacities, and obviously the clinicians, like you say, have a very short amount of time. But the fact that the model works in such a good way where the non-clinical professionals are able to work with the clinical professionals in a way that kind of you can both manage your time, but also helping the individual feel heard, feel seen, and actually get to the root of some of those maybe issues that are kind of rising more to the surface, if you like. Kind of often easier to see, aren't they? Whereas actually when you kind of dig deep and listen to someone for an hour and a half, you can really get to the bottom of what it is that's causing people to struggle and to have issues in their lives. Definitely. Amazing. What's your favourite thing about the role?
I think just that sense of that I know that I'm helping people in my community and I am taking action to help my community. All the time I get great thanks from either people that I'm working with as in individuals that have been referred, or even medical professionals, because sometimes they are literally, in the dark and they are really trying to help people, but they can only help based on the information that's provided. So I just think that whole sense of, I know it's positive, it's a very positive thing to do. It's just priceless, really.
Amazing. So in terms of, Social Prescribing is a partnership that we obviously have with the Didcot PCN, the primary care network. But how else do you think that it links into the wider mission and work that's already being done at SOFEA?
Well, I think, quite often we will come into contact with individuals that may have some contact with SOFEA in some capacity. So whether that be that they may have a young person here in the education programme, or they're a member of the community larder. It's also a great way of signposting. Obviously, there are other services within SOFEA, and just, working together as a team. Obviously, we've got the employability that, we quite regularly get involved with that side.
So SOFEA is effectively a place that you would signpost people to if you can identify there's an appropriate need. So someone gets referred to you from the GP surgery. It might be a family where the young person is struggling to get into education. You would then signpost the young person to the education, and then they can navigate their way through the SOFEA journey, if you like, and access support, not just from one door in, but all of the services that we have to offer and the rest in the community. Yeah,
absolutely. I kind of view myself as I'm the first cog in the machine that kind of starts then to open up the doors and all the cogs kind of working together.
It really is like a good example of kind of how the sum of all parts can work really well together if the transition pathways are there for people to access services. And I know we've been talking a lot with the PCN about improving access, because that seems to be, high on the agenda of priority this year, doesn't it?
Yeah, absolutely. That is something we're focusing on a lot.
Okay, my final question for you is, how can people refer for the social prescribing support?
So the thing with our contract at the moment, so we actually only work with the 3 surgeries in Didcot, so that being Woodlands, Oak Tree and Didcot Health Centre. Now, any professional at the surgeries can send a referral in, so that can be from reception right through to the doctors. We do have clinics that are there available to book straight into, so again, ask reception, or you can contact us to put in a self-referral. That's not a problem. And all I'd say is, if you're listening from outside the Didcot area and you're interested in getting support through social prescribing, is to contact your surgery. They all work a little bit differently. They've all got different agreements, but, it is out there. It is quite a widespread across the country now. So, just get in contact with your surgeries.
A big thank you to Selina for coming onto the podcast today. As always, please do like, share and subscribe. And if you'd like to get in touch, just contact us via the website, or you can email us at wellbeing@sofea.uk.com.